I get a lot of patients, whether it's in my clinic or online, that ask me about dietary concerns when it comes to weight loss. They say, that they'll lose weight for a short period of time, but then they may gain it right back. And there are two really big factors that I see in this. One is that you have to think about that these patterns that you have, whether it's reaching for something sweet or, a lot of people, and I experienced this because my whole journey started in weight loss, is that it's like you don't even realize that you're eating things until it's all gone. It's just like a reflex almost. So one of the things is that these patterns build in your brain, and the more that those patterns happen, the stronger that they get. So you have to break that, what's called a neurological pattern. So if you find yourself reaching for chips or junk food all the time, it's something that you have to take time to consciously stop yourself. And this is something that I have patients practice when we're working through weight loss programs or helping them resolve binge eating or anything like that, is that I'll actually have them intentionally grab for the food and then pull back and do that around maybe 10 times, and do that several times a day. And what it does, it trains a new neural pattern in your brain so that instead of grabbing it and just putting it in your mouth, you learn to stop and reject that. And it's just like a muscle. The more you exercise it, the stronger it gets. And I see patients that, maybe they go from, let's say, 9 out of 10 times, grabbing it and automatically doing it, that it reduces it by 80%. So maybe only, 2 or 3 times that they'll actually grab the food and start eating it. So it's a really cool trick that I found, just based on my understanding of neurology and how these patterns happen. The other thing is that candida is a huge issue. So if you have heavy antibiotic use in the past, if you have a white-coated tongue, recurrent UTI infections, if you've had kids, the more kids, the higher the likelihood. If you crave sugar all the time, if you crave caffeine all the time, if you wake up feeling tired, feel like you need a nap at 2 or 3 o'clock in the day, then that is an issue that needs to be addressed. And there are things that you can do to address it, but candida is something that's very hard to reverse. So hopefully this helps. If you have any questions about that, this is just something on my mind, then just comment below and I'll give you my best piece of advice. Thanks.